Fellow citizens, as a nation, we, like the rest of the world, continue to face the daily challenges caused by this awful coronavirus pandemic. For the second year in a row, our national celebrations have been greatly curtailed by this pandemic. Of course, where COVID-19 is concerned, we are not alone. The world over is dealing with the daily challenges caused by infections and death. Together as Belizeans, many of us have worked hard to limit infections and to follow the advice of the experts at home and abroad. Yet even with the best efforts of many, we find ourselves in the midst of a third wave of the virus, one that is aggressive and is causing infections at a more rapid pace. For those of you who have not been taking this matter seriously, let me address you directly. The current situation in Belize is indeed alarming. The last report from the Ministry of Health shows that the number of daily new confirmed COVID cases have been increasing dramatically. Yesterday alone, there were 200 new confirmed cases with a positivity rate of 16.4%. As of yesterday, there were 1,416 active cases in the country. Our hospitals are at a breaking point. At the KHMH alone, there are 28 COVID-positive patients admitted. 10 of these patients are in the intensive care unit, and of these, 7 are unvaccinated. Over the weekend, there were 9 deaths attributed to COVID-19. Our medical professionals tell us that of the number of persons dying from COVID, close to 85% are persons who are unvaccinated. We know that persons who are vaccinated are less likely to end up in the ICU and even less likely to die because of COVID. Yet there are those Belizeans who refuse to get vaccinated. Perhaps some of the anti-vaxxers feel that government must not interfere with their personal liberty or freedom of choice, but government must protect our children, healthcare professionals, and those citizens who are following the regulations by getting vaccinated, and we will do so. Let me be clear. Government will do what is necessary to pass appropriate legislation that will protect our children, healthcare workers, and vulnerable citizens who are doing everything possible to ensure each other's safety. By now, we have all seen and heard what is happening to our healthcare facilities across the nation. Our doctors, nurses, lab technicians, pharmacists, attendants, public health inspectors, and other healthcare workers have done a Herculean job in managing the sick, COVID and non-COVID alike. All these workers are reaching the point of exhaustion. They are now in desperate need of some form of relief. For their heroic work, we owe them this relief and can assist by doing our part, which is to get vaccinated and to adhere to the safety guidelines. I know we can all do this because we have done it before. When we took office last November, COVID cases were on the rise, hospitalizations were up, and deaths on some days reached as high as 10. We implemented the necessary measures to stop the spread, and together we were able to bring the number of cases down to a level where we could open our economy safely. We are once again faced with circumstances that require collective action, and so to deal with the precarious situation we currently face, to guard the health and economy of the nation, and on the advice of our healthcare professionals, Cabinet is forced to take drastic measures by imposing the following restrictions. Starting Sunday, the 20th of September 2021, and for the next 2 weeks, the new measures are as follows. 1. A curfew is imposed countrywide, starting at 7 p.m. to 4 a.m., except for San Pedro, Kikoka, Placencia, and Hopkins, where the curfew will remain from 9 p.m. to 4 a.m. 2. Restaurants will only be able to provide takeout service except for restaurants in San Pedro, Kikoka, Placencia, and Hopkins. 3. Casinos and churches are to be closed. 4. Any form of contact sport is not allowed. 5. Sunday 26 September and Sunday 3 October 2021 will be declared no movement days except for medical attention to purchase medication, groceries, or fuel. We are implementing these measures because projections from the Ministry of Health and Wellness show that if nothing is done, we can expect to see an increase in daily COVID infections of up to 250 new confirmed cases. At this rate, hospitalizations could rise by an additional 150 persons daily over the next 2 weeks. Of those hospitalized cases, approximately 15 will require ICU admission, and a minimum of 10 daily deaths are projected. By imposing these measures, we hope to avert a worsening of the COVID pandemic and avoid a complete country lockdown. As I said before, when we work together, we were able to keep this awful pandemic somewhat under control. We also give our hard-working healthcare professionals a chance to get some rest, to better cope with the cases in front of them, and to try and deal with some of the psychological trauma they face in this line of work. Yes, we are an entire nation under stress, but just imagine what our doctors and nurses are going through every day. We can help them and help ourselves by working together to reduce the number of infections and reduce the number of hospitalizations. Remember, the virus cannot move unless we take it with us. Vaccination and the adherence to the current public health measures is the only way for us to reduce the spread of this highly infectious and deadly disease, and in so doing, save lives. My appeal to you tonight is to join in this fight to defeat the spread of the coronavirus. Everyone has a role to play, from parents who must protect their children and the elderly, to shopkeepers and business persons who we are asking to insist on strict hygiene protocols to enter your establishment. From community leaders to pastors, all of us must come together now in the fight to get control of this deadly virus. For those who have not yet been vaccinated, please do so. We have now opened all vaccines to every Belizean aged 12 and up, and all of our vaccines are safe and free. Stay home, and remember, if you must go out, watch your distance, wash your hands, and wear a mask. I thank you.